My father was a physician, and he served in the oldest hospital in Chicago, Mercy Hospital. He was a retinal specialist. He was an ophthalmologist. But he came from Kentucky, and his father was a physician who was from Mississippi, born in 1902. He wasn't allowed to practice in most places because of racism and the state law in Kentucky, but he became the first black anesthesiologist in Kentucky. And he served a rural community of Shelbyville, Kentucky from 1930 to 1945. He was the only black doctor in that community. And he wasn't allowed to have white patients. So this is coming full circle for me. And I thank my father so much for not having pushed me into medicine. I've been an awful, awful physician or nurse. I'm particularly interested in innovation in the healthcare sphere. I taught organizational innovation at Temple University for 4 years. And so I'm really interested in how we address many of the points you mentioned, Dr. Cohen, with regard to the social determinants, processing what happened during the pandemic, who lived, who died, who was hospitalized longer. How do we kind of disaggregate that information and understand what went wrong, what we can learn from those experiences, and how do we create more vibrant communities, urban, suburban, and rural, to help folks gain access and gain trust?
As in the innovation sphere, the true innovators are very few and far between. It's a personality defect, and quite honestly, being one of them, it's difficult for people to put up with me. Okay, they're the ones that are confident in themselves. They have an idea. So we ask them 3 questions: what's the problem you're trying to solve? Who's your customer? How do you get paid to make it a sustainable option? But it's the same thing with the healthcare organization. From a legislative point of view, I'm not a legislator, I couldn't answer it. But fundamental to institutions of community, healthcare, education, government, and religion is this underpinning of trust. And every one of these folks will tell you exactly the same thing. A patient won't come in and let you take care of them if they don't trust you. They'll leave and they'll go somewhere else. To be able to display that empathy to people, no matter who they are, the healthcare community doesn't see them the way the rest of the world does. And the ethics of healthcare is that you're there to help, whether they're a prisoner, whether they're a convict, a shooter from Tree of Life, a CEO, is that you're not there to judge, you're there to help them.
Across our areas, as hospitals close or they get significantly scaled down, it affects the human condition in and around them in an economic way. Anything that legislatively can, for us, I've noticed that we have a community residency that produces family practice physicians. And we had over 700 applicants for 4 slots. There are people who want to do healthcare. We have been able to retain a large number of these physicians as primary care doctors in high-risk areas. Anything that helps us to educate, tuition forgiveness for all sectors, encouraging people to be preceptors and teachers, the more that we can educate in both traditional roles and in community health workers roles is what I would consider, your initial low-hanging fruit, while we go down the path of necessary innovation and changes in model.
It is the society that's the problem. It's not the social. It's not the individual. And it drives our health. It doesn't determine exactly how you're going to be, but it drives you. It pushes you in one direction or another. And what we know, based on even what Representative Rabb said, is the trust issue, right? And so what we're trying to do is create a workforce that is trusted, that is part of a community and can help sort of translate. I always say, medicine is a language. If you get into medicine, you're learning a new language, right? But we're not good at communicating that language to others who haven't learned our language. But there are people who are community health workers who can be trained in how to navigate that. And to be honest, the cost is little to train a community health worker, and the impact is much greater.